Hello, class. Today we'll be talking about two very important life-saving skills that have to do with external bleeding control. We'll be utilizing direct pressure along with tourniquet application. By the end of this lecture, we should be proficient and confident in bleeding control, again by using direct pressure and proper tourniquet application. First off, what is external bleeding? What is external bleeding? Well, it's pretty evident. It's visible hemorrhaging of blood. And if you lose about 2 pints of blood, that is, then you're susceptible to complications. Uh, Bleeding is a serious problem. It obviously entails serious attention if blood loss is again reaching that 2 pint level, or if it's even more so. Some general things to look out for that could indicate serious problems. Appearance is the first thing. You can look, the paleness will indicate serious blood loss. Symptoms of shock, which we've talked about before. Um, Evident blood pooling. If you see blood on the ground in large quantities, that's pretty serious, easy indicator. Always look out for general impression. If you can see what the mechanism of injury is, that can kind of clue you into the severity of the bleeding, external as we're talking about, but also internal. Okay, and there are several methods that can help you to control bleeding. The first thing we're going to do is we're going to apply direct pressure. If it's not a major bleeding, that should be able to control it. But if it doesn't, we're going to turn to other procedures such as pressure dressings and tourniquet application. So first off, we go to a scene, we see someone exhibiting external bleeding. First thing we're going to do is, as always, we're going to ensure that BSI, the scene is safe. We're going to be taking standard precautions, utilizing the use of gloves, for instance. So first and foremost, with a gloved hand, we're going to apply direct pressure, firm, and we're going to hold it for about 5 minutes. Is how long it may take to kind of get the bleeding under control. Uh, we can remove our hand at that point and see if the bleeding has subsided. If not, we can take a dressing, a pressure dressing in this case, and apply it. Take the dressing, direct pressure, firm, hold it for about 5 minutes, and you can see if the bleeding has stopped. If it's slowed, if it's slowed and showed signs of stopping, you can at that point take some gauze, wrap it around, and that will be that'll serve as a pressure dressing at that point. And you want to stretch the bandage tight enough to ensure that the bleeding is under control. Now at this point, you'll want to take a blood pressure reading. So grab your cuff, as we've done before. You'll take the cuff, take a distal pulse, and make sure that you should still be able to feel a pulse, though it may be a little weaker if the pressure is too severely applied. Okay, and at this point, you're going to apply additional pressure if necessary. Now, to do this, since we already have this dressing in place, you don't want to remove it. You can, at that point, take another dressing, apply it on top of that one, and same thing, you're going to take the gauze and wrap it around again. Ensure that it's tight in place, firm pressure is applied. At that point, hopefully the bleeding will be under control. If not, we can turn to a tourniquet at that point. So I'm going to demonstrate self-administration of a tourniquet. A little bit harder than if you're putting it on someone. So first off, you're going to place it proximal to the injury. So say that you're exhibiting bleeding, say around this area, take it up a few inches. First thing you're going to do, you're going to take the strap, pull it tightly around, as high as you can for the most part. And then at that point, you're going to turn this device, cinch it down even further, as tight as you can really get it. You're going to Velcro it in place. At that point, you should take another additional distal pulse. If it's tight enough in place, you probably will not get a distal pulse reading, which means that it is adequately secured. Some things you're going to look out for when you're applying a tourniquet, you'd never want to place it, say, directly over a joint. Again, you're going to do it proximal to the injury. Just keep that in mind. Keeping it tightly secured. Uh, if you can avoid it, you don't really want to use things like a belt, wire. Problem with that is once you put that on tight, it'll dig into the skin, could cause further injury. You could put some, say, padding underneath the tourniquet that'll, say, you could use some rolled up gauze that'll serve as a little barrier, it'll help protect the skin. And it's always important to remember, do not loosen the tourniquet after you've applied it. Even if the patient says they're experiencing a little bit of pain, they will be. It's necessary. You're cutting off blood supply, and they may feel a little bit of pain from that. But a little pain is all right as long as it's preserving life. Okay, so just things that we've already talked about. Just keep in mind, it only takes about 2 pints of blood to start experiencing complications of blood loss. They could start, the patient could start showing signs of shock. Their appearance could be, they could be pale. Just look out for blood pooling, how much blood they've already lost. And we're going to practice applications of direct pressure dressings, tourniquet usage, and once we're done with that, if y'all have any questions, I can address those. But on a nutshell, that's external bleeding control, and that concludes the lesson for the day. Thanks for the time.